Right. From Nairobi, let's now move to Nakuru, where the rising disease burden is a matter of concern to both residents and leaders.
Well, Kabazi MCA Peter Mbai is moving a motion seeking to compel the county government to develop a comprehensive program for screening residents for diseases like cancer, diabetes, and hypertension, among other preventative measures as well. Marianne Nyambura is in Nakuru now. She's joining us live with details on that story. Marianne, how exactly is this program going to work?
Good morning, Trevor and Zinzi. And as you mentioned, is that there is a high burden of these cases of cancer, hypertension, diabetes, and other chronic diseases. Remember that once devolution, or rather once health was devolved, the move was taken to the counties to ensure that the health services are provided to the patients, or rather to the residents of each county. And we understand that at the Nakuru Level 5 hospital, over 5,000 patients are taken, or rather within a span of a year, are taken to the oncology center for treatment or as well as screening. This is what informed the decision to bring forth this motion. And again, is that data from the World Health Organization indicates that 18.1 million cases of cancer reported yearly, 9.6 million deaths reported as well, and as well as for hypertension, 422 million adults have diabetes in a span of a year. But joining me here to tell us more about the motion which has been tabled at the County Assembly is Dr. Peter Mbai, who is the MCA Kabazi Ward. Thank you so much, Dr. for joining us. Maybe you could start off with what informed this decision.
Thank you. Yesterday I tabled a motion that seeks to compel the county government to do an annual comprehensive screening for cancer, diabetes, hypertension, and other non-communicable diseases at the grassroots. What we know is that by the time people come to level 4, to level 5 hospitals, by the time these people are able to feel they are ill, maybe the cancer is stage 3, stage 4. And most certainly, most of them don't come back alive. So what we are saying is this: health is a devolved function. The president has been speaking about UHC, the universal health coverage. Now, what we are doing as a county is to take our role, because health is devolved, and do legislation, because this is a motion. It was passed unanimously by the members yesterday, and we are giving the county government department maybe a month or so to roll out strategies, and then be approved by the county assembly. By the 1st of July, it's going to be annual, so that at each center, when you do 2 or 3 days and completely screen everybody, next year they'll be waiting for it, because as you know, at some age, you need to do screening annually. So what we are saying here, I want to thank the First Lady. Margaret Kenyatta has been learning. I've been learning personally for the cause of cancer and all those kind of things. And she has donated 2 mobile clinics in Nakuru, for example. What we are asking the government to do now is don't put so much weight on curative. By the time you put billions and millions of shillings in Nakuru, 43.6% of the county budget goes to health. So what we are saying, don't go so much on curative. Can we go to preventive? Okay. Let's go to where the people are, because these people don't have any other way. They don't know any other method of how to get better. These are our old women. This is the aging population. Maybe myself, I would get an insurance and go and get a cover, but they don't have any other way. We want to say, this is what we want to do, and do it in a structured way. Yes, we know something has been going on, but not structured. We want to clear all these things. Yes.
And how long do you think the motion will take? How long will it take to ensure that at the end of the day it becomes successful?
Very good. Now, the motion passed yesterday. So in a day or two, we are going to write to the Department of Health. We are giving them for the purpose of planning until the end of this financial year. So we want this program to be running from 1st of July to 30th of June every year, so that this program will cover all the wards, all the centers in all the major wards, so that everybody knows this is where I'm going to get comprehensive care. This is the work of government. Health is one of the most basic things enshrined in the Constitution. So what we are saying is to bring that up. And I want to add this. So within 2 months, the county will bring to the assembly a program, how it's going to be done, and then they are going to start. And we are saying we don't need additional money. The money we give them is enough. All what they need to do is to have priorities right, to go and concentrate on preventive. And you look at the statistics. Look at what has happened to our MP. Now, this is the reality we are facing. Look at the key people we have lost in this country. And we are saying we are facing personally, and other members, all of us, we go daily to burials of people who ought not to have died. Some of the medical camps we have done, we have been able to save lives. Cervical cancer, stage 1, stage 2, ladies, and all that. Quite a number already. But we are saying how many more are there? They are not being reached. Many people today, they live with hypertension, diabetes, they don't know. Today, many people don't know they are suffering, and that is a danger. So what we are saying, let screening be done so that early enough, cases that can be helped can now be referred to now the oncology center, that the one we have in Nakuru and others, they can be referred. But let us give our people, the least thing we can do is to give our aging population the chance to be looked at. And the idea is devolution came and is good, but we want to see devolution to the grassroots. We want to see devolution to the villages. We want to see these things, services happening where the people are, because that's what our role is. And so we are playing our part as a county assembly, and I want to thank the speaker for approving the motion. I want to thank my colleagues, the members of the county assembly of Nakuru, because it passed unanimously, and it was well, and we observed actually a moment of silence for all the people who have cancer. And we are saying our time has come to do something about it. Thank you.
Thank you. That is MCA Kabazi Ward, Dr. Peter Mbai, shedding more light about this motion that was tabled in Parliament yesterday, and him stating that there is need for health to be taken to the grassroots level rather. This Nakuru County has a total of 55 wards, and this is a motion that will see cancer cases, or rather, Dr. Mbai is saying that there is need to do for the preventive measures than curative measures. Back to you, Trevor and Zinzi.